All right, everyone, get ready, because we are diving deep into the world of pharmaceuticals.
Those everyday meds, yeah, the ones you hear about at the doctor's office.
The kind you might even see in those, flashy TV commercials.
We're going way beyond just the names and what they're for today.
We'll uncover how they actually work, their mechanisms.
And I bet you will uncover some interesting facts along the way.
I think we will. So to help us with this deep dive,
we're turning to Dr. Khalid Hassan's podcast.
He breaks down common prescription drugs.
He does it alphabetically, which is great.
We're going to group them a bit differently this time.
We're thinking about organizing them by what they treat.
Yeah, like what systems in the body they target.
This way, we can connect the dots between drugs.
The drugs that are used for, similar conditions.
Gives you a more complete picture.
It does. It does. Let's start with something a lot of people deal with.
Okay, what's that?
Acid reflux.
Oh, yeah, very common.
Yeah.
AcipHex.
Or, generically, Rabeprazole.
That's often prescribed for this. It's a proton pump inhibitor.
Now, for those who don't know...
Remind us.
Yeah, what exactly is a proton pump inhibitor?
Well, it basically, it turns down that acid production in your stomach.
Turns it down?
Yeah. It blocks this enzyme, the one that's, responsible for making all that acid.
So it helps with the heartburn?
Heartburn, yeah. The ulcers.
Exactly, those burning sensations.
But reducing stomach acid like that, are there any long-term things to think about?
That's a great question. And yes, there are studies, linking prolonged use of these proton pump inhibitors to certain vitamin deficiencies.
Interesting.
It really highlights how important it is to talk openly with your doctor about the good and the bad.
The risks and the benefits.
Exactly.
Absolutely. Okay, let's move to a different digestive issue. Constipation. Senna?
Yeah.
Sold under brands like Ex-Lax and Senokot.
Familiar names?
Right. It's a laxative, but how does it actually, get things moving? So, Senna, it stimulates those muscles in your intestines.
Okay.
Encourages those bowel movements.
Gets things going.
It does.
Now, moving on, we got to talk about the heart.
Cardiovascular system, crucial. Yeah.
Let's start with Ramipril.
Or Altace, yeah.
It's an ACE inhibitor, right?
It is.
What's so special about that class of drugs?
Well, Ramipril, being an ACE inhibitor, helps relax those blood vessels, which of course lowers blood pressure.
Makes sense.
And that ACE stands for angiotensin converting enzyme, which is a mouthful.
It is.
But basically, it's involved in constricting those blood vessels.
There you go.
So by inhibiting it, Ramipril lets those vessels widen, easier blood flow.
So someone with, say, high blood pressure, heart failure, kidney disease, even an ACE inhibitor could be part of the plan.
It could. It's really interesting how one drug can have these cascading effects, on multiple systems in your body.
It's amazing how the body is all connected.
It is.
Okay, now for those high cholesterol levels, we've got Rosuvastatin, otherwise known as Crestor.
Yes.
And then there's Simvastatin, which is also known as Zocor.
Both of those are statins.
The famous statins.
Famous for a reason.
They really are.
Yeah.
So high cholesterol, for folks who don't know.
It's like this sticky buildup in your arteries.
Not good.
No. Increases the risk of all those heart attacks, strokes.
So how do statins work?
They go after an enzyme, one that the liver needs to make cholesterol.
So they stop it at the source.
Exactly.
So they're playing a preventative role.
Absolutely. Huge part of preventative cardiovascular care.
Now, what about blood clots? Rivaroxaban, also known as Xarelto.
That's a big one.
It's an anticoagulant.
Preventing those clots,
So it's all about preventing those dangerous clots, right?
Right. It targets a specific clotting factor in the blood.
Interesting.
To stop those clots from forming. This is crucial for people with conditions like atrial fibrillation, where the heart rhythm is irregular.
Increases stroke risk, right?
Exactly.
So keeping that blood flowing
smoothly.
All right, let's shift gears again.
Okay, where to?
To diabetes.
Sitagliptin.
Also known as Januvia.
Anti-diabetic drug.
Yep, specifically type 2 diabetes.
Okay, reminder on what happens in type 2.
Sure, so the body's either not making enough insulin, or it can't use the insulin it does make effectively.
And insulin's key for blood sugar.
Absolutely, regulates that blood sugar.
So how does sitagliptin help?
Well, it's kind of two-pronged. See, it helps the pancreas make more insulin. And it also reduces the amount of glucose the liver makes.
Two birds, one stone.
Exactly.
Keeping those levels in check.
Precisely. And that's vital to prevent complications, long-term complications from uncontrolled diabetes.
Yeah, like damage to
nerves, eyes, kidneys.
Okay, on to mental health.
Important area.
It is.
Yeah.
Sertraline or Zoloft?
Ah, yes, Zoloft. An SSRI, selective serotonin reuptake inhibitor.
Long name.
It is. Break it down for us. The serotonin, the reuptake, all that.
So serotonin, it's a neurotransmitter.
Okay.
A chemical messenger in your brain.
Got it.
And it does a lot. Regulates mood, sleep, even appetite.
Wow.
In conditions like depression, those levels can be off.
Off balance?
Yeah. So sertraline increases the amount of serotonin available.
So it's like boosting it.
In a way, yeah, to help improve mood and those symptoms.
Risperidone.
Or Risperdal.
That's an antipsychotic.
It is for serious mental health conditions.
Right, like schizophrenia.
Bipolar disorder.
Those are tough ones.
They are characterized by disruptions in thinking and emotions.
And risperidone helps how?
Well, the exact way it works is still being studied, but we know antipsychotics like this regulate dopamine and serotonin activity.
In the brain.
Yeah, which can reduce those hallucinations.
Yeah.
The tough symptoms.
It's remarkable how medicine can target these pathways.
It is complex stuff.
Let's talk about bone health now.
Okay, important for everyone.
Especially as we age. Risedronate or Actonel?
That one's a bisphosphonate.
Okay, bisphosphonates, what's their deal?
They slow down bone breakdown.
Ah, so they're protecting the bones.
Exactly, maintaining density and strength.
Like a bone protector.
Kinda, yeah.
And then there's Raloxifene or Evista.
Another one for osteoporosis.
But it works differently, right?
It does. It's an estrogen modulator.
What does that mean?
It mimics estrogen, but only in certain parts of the body.
Like the bones.
Yeah, bones, but it blocks the effects elsewhere.
Interesting.
It helps protect bone density. Postmenopausal women.
Yeah.
Without the risks of, traditional hormone therapy.
Got it. Very targeted.
It is.
Okay, let's talk overactive bladder.
Okay.
Sulfatinacin, also called Vesicare.
Yep, that one's an antimuscarinic.
Okay, antimuscarinic, what is it?
It blocks nerve signals.
Okay.
The ones that trigger those involuntary bladder contractions.
So it's all about control.
Exactly, regaining control.
Well, people aren't,
running to the bathroom constantly.
Right. Now, Parkinson's disease.
A tough one.
It is. Ropinirole or Requip.
Yep, helps manage this neurodegenerative disorder.
Parkinson's is?
Loss of dopamine-producing cells in the brain.
Which leads to?
Tremors, stiffness.
Movement problems?
Yeah, it's tough.
So how does Ropinirole help with that?
Well, it actually mimics dopamine.
Oh, wow.
Steps in to compensate.
Amazing.
It is. The brain is fascinating.
It is. Now, let's talk about fighting infections.
Okay, crucial area.
Raltegravir, also called Isentress.
That one's for HIV.
It is.
Targets a very specific step in the HIV life cycle.
Which is?
So HIV, like all viruses, needs to insert its genetic material into our cells.
To replicate, right?
To replicate, exactly.
Right.
Raltegravir stops this process by inhibiting the enzyme integrase.
Which HIV needs.
It needs it to insert its DNA.
Wow, so it blocks the replication.
It does. It's quite remarkable.
It is. Thinking about HIV treatment, what were the challenges before these types of drugs?
It was much tougher, less effective.
The older drugs.
More side effects. Couldn't fully suppress the virus a lot of the time.
So these newer medications are game changers.
Absolutely. People living longer, healthier.
That's amazing. And let's talk about another breakthrough, sofosbuvir.
Or Sovaldi for hepatitis C.
A liver infection, right?
Yeah, viral infection.
How does this one work?
It's a direct-acting antiviral.
Meaning?
It goes straight for the hep C virus.
Attacks it directly.
Stops it from replicating.
And this is better than older treatments, huh?
Well, the older ones were less effective, more side effects.
Sofosbuvir has?
High cure rates, well tolerated.
A real game changer.
It is.
Okay, last one, Stelara.
Also known as ustekinumab.
This one tackles autoimmune conditions.
Conditions where the immune system attacks the body.
Not good.
No, not good. Stelara is a monoclonal antibody.
Okay, what are those?
They're biologics, complex drugs derived from living organisms. Stelara blocks specific proteins.
Okay.
The ones that drive inflammation in autoimmune diseases.
Like, say?
Psoriasis, Crohn's disease, ulcerative colitis.
So it's calming down the immune response.
Exactly, reducing that damage.
Wow, we have covered a lot of ground today.
We have
so many medications.
Important to remember.
Yeah.
This is just the beginning.
Right.
Talk to your doctor. They know your individual needs.
Always, always. This deep dive is just a starting point.
Keep learning. stay curious.
And always have those open conversations with your healthcare provider.
Absolutely.
Thanks for joining us.
Thanks for having me.